House GOP's sweeping budget bill up on the table tonight includes significant changes to Medicaid, sparking controversy across the political spectrum. But some House Republicans want even more conservative reforms to the program.
We are looking at one thing. We're not doing any cutting of anything meaningful. The only thing we're cutting is waste, fraud, and abuse.
Nearly $880 billion in cuts to Medicaid is being touted by the president and House Republicans as a way to crack down on waste, fraud, and abuse. But New York State officials, including Senator Chuck Schumer, are calling it devastating, warning it could pull the rug out from millions of low-income families.
Here's the big, ugly truth on this so-called big, beautiful bill. It would cut health care. Would enact the largest cut to Medicaid in all of American history.
The bill is also proposing to cut Medicaid spending with new work requirements for adults deemed physically capable of working and more frequent eligibility checks. However, with 1 out of 3 New Yorkers using Medicaid, the changes could hit New York harder than most states.
1.5 million New Yorkers would be kicked off their health insurance. And New York's healthcare economy would be cratered, ripping away $13.5 billion every single year.
In the greater capital region, spanning congressional districts 19, 20, and 21, state data found that more than 113,000 residents could be stripped of their Medicaid coverage if the proposal moves forward, and hospitals across the region could lose $80 million in critical funding. Like many of her GOP colleagues, Republican Congresswoman Elise Stefanik, who represents New York's 21st congressional district, insists these aren't cuts, just efficiencies, adding, quote, "By rooting out waste, fraud, and abuse, we are protecting and preserving benefits for America's most vulnerable." The president met with House Republicans today in an attempt to court party holdouts like New York Congressman Mike Lawyer and others.